My name is Dr. Lydia Makaroff, and I am the Chief Executive of Fight Bladder Cancer. Since the start of the coronavirus pandemic, medical and scientific professionals have been working to develop a vaccine to help stop the spread of the virus. We have all felt the impact of the pandemic, and this has been an incredibly challenging time. Happily, following extensive trials, safe and effective vaccines for COVID-19 are now available to help protect you from the virus. Tens of millions of people in the UK have now had their first dose of these vaccines. It is recommended that you have a vaccination when it is offered. The vaccines have undergone months of rigorous testing, and the vaccine approval process means that we can be sure that they meet strict safety standards and offer high levels of protection. The vaccine cannot give you COVID-19 infection and will also reduce your chance of becoming seriously ill. Getting vaccinated means protecting yourself from the virus so you can be there for your family and friends. The free vaccine is ready to protect you against COVID-19. Many people with cancer and their family members are in a priority group for vaccination. Your healthcare team will be in touch to invite you for a vaccine. Here are some questions you have asked us about the vaccine and some answers. Can I still get the vaccine if I'm getting BCG treatment? Yes, you still can get the vaccine unless your medical team advises otherwise. Some doctors might decide to leave a gap of 1 or 2 weeks between the vaccination and BCG treatment. The vaccination should not interfere with the effects of BCG on the cancer. Can I still get the vaccine if I'm on chemotherapy, immunotherapy, or targeted therapy? Yes, unless your medical team advises otherwise. Some doctors may suggest that you do not get your vaccine on the same day that you receive chemotherapy. Experts on cancer immunotherapy and chemotherapy have recommended that people on immunotherapy and chemotherapy should receive the COVID vaccine. If you have been recommended to start treatment that affects your immune system, such as chemotherapy or immunotherapy, then receiving a COVID vaccine before treatment starts may improve the effectiveness of the vaccine. But in some situations, people may need to start treatment before having the vaccine. It is possible that the vaccines may be slightly less effective for people having chemotherapy or immunotherapy, but it is still expected that the vaccine will give useful protection against the virus. Should people who have already had COVID or are suffering from long COVID get vaccinated? Yes. The scientists have looked at this and decided that getting vaccinated is just as important for those who have already had COVID-19 as it is for those who haven't, including those people who have mild residual symptoms. If you are suffering significant ongoing complications from COVID, you should discuss whether or not to have a vaccine now with a doctor. How long does the vaccine take to become effective? For most people, protection should kick in about a week or 2 after the second dose. Even those who have received a vaccine still need to follow social distancing and other guidance. Who cannot have the vaccine? If you are allergic to any of the ingredients in the vaccine, you should first talk to your medical team. Can I have the vaccine if I'm pregnant? The experts have updated their guidance to say that pregnant women and those who are breastfeeding can have the vaccine, but should discuss it with a doctor to ensure that the benefits outweigh any potential risks. The NHS has already started to give the vaccines to people. You will be contacted by the NHS for your vaccine appointment. It is recommended that you have a vaccination when it is offered. You should continue to follow government advice on keeping safe, even when you have had your vaccine. Fight Bladder Cancer is here to support you. You are not alone. We are family.